All right, so stress and stroke and oh my gosh, we all have stressful lives. Well, I think we're going to find out that has something to do or can have something to do with stroke. We have Dr. Alan Berman with us. Nice to have you on.
Thanks.
Also Karen Russell, and you are with the Mountain Valley Regional Rehabilitation Hospital. You deal with this kind of stuff all the time. So I just have one question, like if you go, oh my gosh, I'm so stressed out, I thought I was going to have a stroke. Is that like true? Could that really happen?
There's some truth behind that. Stress causes a lot of the diseases that can lead to stroke. It's unlikely that somebody would have a single stressful event that would cause a stroke on the spot. But overall, it's cumulative. Yeah, it can.
It's like sun damage. It's going to build up on you, so you might want to watch that. So, what is stroke? I mean, exactly, because I mean, we sort of, some of us have some experience with them, but some don't.
One way to think of a stroke is that it's a brain attack. And there are two ways that it can happen. The first way is that you can have a loss of blood supply to the brain. The second is that you can actually have bleeding into the brain. And those are the two main causes of strokes.
So too much blood, not enough blood.
Right.
Okay, that's a fine balance. I mean, true. Oh, okay, so, sometimes I think, well, stroke is a cataclysmic event in terms of what you see when a person has had a stroke, the paralyzation, all this kind of stuff. But what are some of the signs and symptoms that you might be having a stroke?
The most common types of things are people will tell me that they've had some tingling or numbness on one side of the body. They have trouble speaking, balance becomes an issue. People who are talking to them think that there's something wrong with their thinking process. And then ultimately you can get weak or paralyzed on one side of the body.
So it can kind of come on slowly then sometimes?
It can, and it often does, and people don't realize the early warning signs and they wait too long.
So if you got in there, if you catch it sooner, like a lot of diseases, this will make a difference in terms of how well you get along with a stroke.
It can. There are some new types of drugs on the market that are called clot busters. And you have a very limited amount of time to get those administered. But if you get into the hospital quickly, some of that can be reversed.
Wow, because I mean, you see some people who recover, like their speech comes back with some work, and they can use their, whichever side of their body was paralyzed. But some it doesn't, and a lot of times it's because of this delayed treatment, if you will.
Yeah, sometimes it is. Sometimes people get the treatment and then they still go on to have a devastating stroke, but the clot busters can help a lot of people.
Make a difference. Okay, so when do you call? It's like, oh, I'm feeling kind of weird. Should you call the EMT, or when do you know when to call for help?
No, I tell people to call right away. You have 3 hours from the onset of symptoms to get treated for the stroke itself. And so if you're thinking that this is going to go away in a few days, which I hear all the time, you're going to be out of luck, and it may progress to the point where you can't do anything about it.
So don't be embarrassed. If you're feeling some of that, the numbness, the tingling, trouble speaking. I have trouble speaking. I don't think I'm having a stroke. It's just live TV. But yeah, it can definitely hit you. So you mentioned some diseases that can be caused that then turn into a problem for stroke. What are those things?
High blood pressure, diabetes, obesity. We see, especially in younger people, we see a lot of people with chemical dependence who go on to have a stroke because of the effects of those types of things.
Really? And is it because it affects that blood supply, the carotid arteries, or the bleeding in the brain, that kind of thing?
Some of the drugs that people use raise your blood pressure so high that it can cause bleeding. Yeah.
How about Rockstar drink? I'm not a user. I just wonder because there's so much caffeine in that thing.
I haven't seen any studies.
An older friend of mine who was with his son at some party or whatever, and he had a couple of Rockstars, and he had like an episode, honest to Pete, he said it was like a psychedelic experience. I thought I was dying or something. But they can be like kind of crazy. So strategies, what do you do? How do you do the most you can do? I know sometimes things just can't be prevented, but what are the best things you can do to try to prevent a stroke?
What we're talking about these days are lifestyle choices. So make sure your blood pressure is controlled. If you have diabetes, check your sugars and make sure those are controlled. Try to lose weight and exercise on a regular basis. Have a good diet. Stop smoking, drink in moderation. The things that you hear all the time from your doctor, those really help.
They're still true.
Yeah.
Okay. What about vape cigarettes? Are those better?
I don't know. There's a lot of studies in progress right now. I don't know what the effects of those
Yeah,
are.
it's interesting because I know you can dial down the nicotine and stuff. I know for those of us who are non-smokers, we love that. It's like no smell. It's just like, woo, this is great. No third hand, problems. Anyway, we're off topic. I do that sometimes. I ramble. And so again, stroke, it happens. Well, you're saying younger people can get it too. So wow, really important. Okay, so you get a stroke. You'll get help soon, or maybe you don't get help soon, but whatever, then you've got to recover from stroke because so many people live through it. Most people live through a stroke, right?
Most people do. What
about rehab? Is that important to get rehab, and why?
Rehab is very important, and the earlier we start, the better. Typically now in hospitals, they'll start doing therapy on the first day that somebody's admitted to the hospital.
Really?
Yeah. We used to have a resting period where we thought it wasn't advisable to get people out of bed and doing things right away, but we realize now that the earlier we start, the better the outcome.
Because I know with stroke, sometimes you sort of forget, your body and your mind forget how to speak or how to move or how to, so is it catching that memory while it's still sort of there?
And retraining. What I hear from people all the time is I'm having to relearn things that I took for granted before.
Oh.
And that's part of the process.
Okay. Yeah, darn, because you had them there and then they're just gone, That happens to me too sometimes. I thought I knew that. No, but very serious. Risk of stroke and prevention, really important. Of course, Mountain Valley Regional Rehabilitation Hospital, there again for something we didn't think. Our medical ideas are changing, and get in there, get fixed up. Wonderful. Dr. Alan Berman, thanks for joining us. And also Karen Russell.
Thank you for having us back.
Woo, don't get a stroke. Ooh, don't get so stressed. Take it easy. A holiday helped, didn't it, right? All right, don't go away. When we come back, speaking of relieving stress, how about a trip to Bali? Let's find out just what that would be like. Thanks so much.